Woohoo. All right. Let's give folks some time to join. What's up? Lisa, how are you? So nice to see ya. Suhaina. Brandon. Hi. Hi, Lando. It's nice to see y'all. All right, we'll get started in a second. So today I'm going to be giving a COVID-19 update. I have a ton of information to share. So if you have any questions, comments, concerns, whatever, you can drop them in the comment section. I'll be sure to try to address those as I give this update. And typical verbiage. I'm going to get us started here. During the past few months, Whitman-Walker's Community Health Department has expanded its outreach efforts to social media. We cover various topics that includes HIV, STI sexual health practices, access to care, social determinants of health, and general public health interventions. Our series of outreach sessions also focus on the pandemic, COVID-19, and ways to manage your sexual, personal, and mental health. I want you all to know that Whitman-Walker Health and our community health team is here to educate and support you. So again, today we are going to be talking about COVID-19. We're still in this pandemic, and it's been a couple of months since I've come on here to talk about COVID. I think the last time I talked about COVID was back in February. And so I have some updates to give you. I plan to cover vaccine eligibility dates for the DMV area, how to pre-register in your area, and cover what we're hearing about DC reopening dates. So please stay tuned. Stay if you have any questions, drop them in the comments. I do have one announcement that I want to start with before we dive into the COVID-19 specifics. As of April 12th, and in extraordinary precaution, the FDA and CDC has recommended pausing the administration of that Johnson & Johnson vaccine. And they're doing this to evaluate those. There have been 6 reported cases of a rare and severe blood clots. And it's important to understand that these 6 cases of blood clots actually occurred in it's only 6 cases out of 7 million doses that were administered. And so that still is very rare and a very small rate. That rate is kind of like 1 in 1 million. So again, it's extremely rare. In all 6 cases though, blood clot symptoms occurred within 6 to 13 days after receiving that Johnson & Johnson vaccine. People who had received that vaccine developed severe headaches, abdominal pain, leg pain, swelling, and shortness of breath within 3 weeks. So if you received that vaccine and you are experiencing any of those symptoms, I definitely encourage you to go to the emergency room. And if you have more concerns after visiting the emergency room, you should contact your healthcare provider. At this time, Whitman-Walker Health has paused administration of that Johnson & Johnson vaccine. So patients who have scheduled an appointment to receive that particular vaccine will have to be rescheduled. Whitman-Walker Health will continue to follow recommendations that are provided by the FDA and the CDC, and we look forward to learning more in the coming days about what those recommendations and more about these unique events. Again, if you have any questions, feel free to drop them in the comments. All right. So let's talk a little bit about COVID-19 numbers. So at the end of last week, nearly 3,000 people across the DC, Maryland, and Virginia area actually tested positive for COVID-19 in a single day. I believe it was last Thursday. Hospitalizations were up across the region. And as of April 11th, Virginia reported the region's highest number of new cases, which was 1,227. And their 7-day average actually grew to 1,486 cases. That's a 7-day average. So good news is that at least 39% of Virginia residents have received at least a single dose of the vaccine. 23% of Virginia residents are fully vaccinated. Now for Maryland, Maryland's 7-day average is at 1,343 as of April 11. Maryland actually reports 32% of their residents have gotten at least the first dose of a vaccine, and 24% are fully vaccinated. Sorry, I have my connection dropped. So 24% of Maryland folks are fully vaccinated at this time. DC reported, as of April 11, 68 new COVID cases, and their 7-day average grew to 120. The district says about 18% of its residents are currently fully vaccinated. All right. So, as you all have known, our president had made announcements about making the vaccine more available, and states are kind of following suit on that as well. And so there has been some changes in eligibility across the DC, Maryland, and Virginia area. So I want to give you all a little update about what that eligibility is at this time. On April 12th for DC, it's actually a week earlier than we expected, all DC residents over the age of 16 are now eligible to receive the COVID-19 vaccine. So if you are over age 16, you are now eligible to receive the COVID-19 vaccine in DC. In Maryland, Governor Larry Hogan announced anyone older than the age of 16 can pre-register to get their COVID-19 shot at one of the state's mass vaccination sites. Hogan previously said all residents 16 and older would be able to get the vaccine. Okay, I'm back again. All right, and so Governor Hogan actually said the vaccine will become available April 27th, but as of April 6th, which is good news, everyone 16 and over is now eligible for the vaccine in Maryland. For Virginia residents 16 and over will be eligible for the vaccine on April 18th. So how do you register a vaccine? If you're in DC, again, as of April 12th, you're eligible. You can actually pre-register for a vaccine appointment at vaccinate.dc.gov. You basically log into vaccinate.dc.gov. There's a questionnaire you complete, and you can either, if you're eligible at that time, they'll set up. You can set up an appointment based off of the availability, or you'll get an email later letting you know that you can come back and actually schedule an appointment. In Maryland, Larry Hogan actually announced that nearly 300,000 Marylanders have already pre-registered. So the demand is there, right? So you definitely want to get in there and pre-register. So pre-register in Maryland is the first step to getting a shot at the mass site. And in order to register, you have to go to onestop.maryland.gov /pre-registration to actually get pre-registered. When you have pre-registered, you will be notified of your scheduled vaccination. You'll be notified to schedule your vaccination when it is your turn. In Virginia, Virginia residents 16 and over will be eligible for the vaccine on April 18th. So at that time, you can visit vaccinate.virginia.gov to sign up and pre-register for a vaccine in Virginia. Good news is that if you're in DC, Maryland, or Virginia, and you're not currently eligible, so maybe you're in Virginia and you want to get registered or you want to get the vaccine before April 18th, there's actually a FEMA vaccine site that is located in Greenbelt, Maryland, that allows anyone in the DMV area that is 16 or older to book appointments. This includes DC, Maryland, Virginia residents, and there are nearly 3,000 shots provided a day. And these vaccines actually come from the federal supply, so it's not coming from Maryland supply, it's not coming from DC supply, it's not coming from Virginia supply. So if you are interested in getting a vaccine, you can also seek this site, and it's called the Federal Pilot Community Vaccination Center, and it's actually located at the Greenbelt Metro Station. So again, there's a FEMA site located at the Greenbelt Metro Station that is currently allowing anyone 16 and over to get a vaccine at that site if you're a DMV resident. All right, any questions about that? I don't see any yet. Cool. So let's talk a little bit about our current U.S. status. Currently, the U.S. is at 36% of the population that has received a first dose or a single dose of the vaccine. Projections actually show, and I want to pull up a graphic for you all. Let me know how that works. Oh, you got it. So as of right now, 36% of the U.S. has received a vaccine, at least one dose of that vaccine. We project that around June 10th, that number may increase to 70%, which is great news. Like, I'm so happy to hear that we're going to be at that place around June 10th. 70% of folks will be at least receive a single dose of the vaccine. So that is the projection. And as you can see on the graph, about 90%, we're hoping that about 90%, and it's projected that about 90% will have been vaccinated by July 15th. And so that is actually really good news. I'm super excited to hear that more people are getting vaccinated. At the current rate that, people are getting vaccinated, this is where the numbers will be. And so keep in mind that at this time, only those folks who are 16 or over are eligible to receive a vaccine. So this does not include, those people 15 and under, none of our children, none of that. This actually is just including those folks who are 16 and over who will be eligible to receive the vaccine nationwide. All right, and so I don't know how to take the graphic off. Oh, yes, I do. All right, so that is the U.S. update, but let's talk about variants. I'm sure you all have heard about these coronavirus variants. So if you're not familiar, a variant basically means that a virus has naturally mutated over time. In that, it means that it changed its genetic code at random as it has reproduced. Viruses with these mutations, we call them variants. That's where the name comes from, because they're slightly different than the original virus that we identified. The mutations we are seeing give us the mutations that we are currently seeing give that variant some sort of advantage. So for example, maybe the mutation allows the virus to spread more easy. Maybe it gets in the lungs more easy. We don't know, but that is an idea of a variant. There are currently multiple variants of the virus that causes COVID-19 that are circulating globally and nationally. The CDC actually has established 3 classifications for a variant. Those variants classification is called a variant of interest, variant of concern, and a variant of high consequence. Currently, there are 5 variants of concern. I am not aware of any variants of interest or variants of high consequence at this time, but I am aware that there are 5 variants of concern. One of those variants is called the B117 variant. That variant was identified in the U.S. in December 2020. It was initially detected in the UK, but we discovered it in the U.S. in December 2020. There's a second variant called the B1351. That variant was first identified in the U.S. at the end of January 2021. It was initially detected in South Africa, so you might have heard it been called the South African variant. It's actually B1351 that was discovered in South Africa in December 2020. There's another variant called the P1 variant. It was first detected in the U.S. in January 2021. The P1 variant was initially identified in travelers in Brazil who were tested during a routine screening at an airport in Japan in early January. Then there's 2 more variants, the B1427 and the B1429. These 2 variants were identified actually in California in February 2021, so very recently. And these were classified as variants of concern as of March 2021. So there are, again, 5 variants of concern that we're still monitoring, we're still learning more about. So far studies suggest that the antibodies that are generated through vaccination with the current vaccinations that are authorized, so the Moderna and the Pfizer vaccine, actually recognize these variants. So this is still being closely investigated, and there are more studies underway to learn more about how, these variants might, or how the vaccine and the variants interact. Scientists are still working to learn more, understand more, and one of those things they're trying to understand is how widely these new variants have spread. Secondly, they want to understand how the disease that causes, how the disease caused by these new variants differ from the disease of, caused by other variants that are currently circulating. So they want to understand the difference between the variants, how these impact the body, and just have a greater understanding of what that impact will be. The third thing that scientists are evaluating is how these variants actually affect existing therapies, whether that be vaccines, testing, or therapeutic therapies that we have in place to treat COVID-19. We're still investigating those things at this time. Lastly, the things I wanted to cover is DC. There have been conversations about how DC will open, what that looks like. There is currently I guess I'll call it a reopening date, but we're not fully opening. But that reopening date of May 1st, we could see some reopening of a lot of things that we haven't been able to do in a while now. So, if the rate of vaccine stays the same or increases, we're likely to see on May 1st, seated live entertainment will be allowed indoors and outdoors at 25% capacity, up to 500 people. Movie theaters will be allowed to operate at 25% capacity. Ceremonies, that includes graduations, funerals, meetings, and any other special events like weddings, bar mitzvahs, will be allowed at 25% capacity. And so those rules will still be in place for those type of gatherings. Outdoor races and outdoor public pools will be open at 50% capacity, and outdoor splash pads, the little things that shoot out water that we see all around DC, that the kids like to run through, they will be allowed at full capacity, whatever that means. Recreation centers, retail, libraries, and museums will be open at 50% capacity. So I want to open the floor to any questions. That is pretty much all that I have for you all today. Any questions about COVID-19, about vaccines, about reopening, about variants? If you have any, drop them in the comments. We'd love to chat with you all a little more. But I think that really wraps up what I have for you all today. I do want to thank you all for tuning in, but I also want to remind you that Whitman-Walker is open for free HIV Sti testing by appointment only, and that is at our Liz location in Northwest DC and our Max Robinson Center location in Southeast DC. You can make an appointment by calling 202-797-4439. I also want to remind you all that social distancing is still the best way to reduce the amount of community transmission of COVID-19. That means you have to deliberately increase that physical space between you and any other person to avoid spreading the illness. Especially around holidays, we have, Mother's Day coming up, we have Father's Day coming up, we have Memorial Day coming up, 4th of July coming up, but we are still in a pandemic. So you have to remember that you still have to stay at least 6 feet apart away from the next person whenever possible. Wear your mask in public, avoid places with large crowds. Work from home if you can. Speak with your loved ones over FaceTime, Zoom, Instagram Live, whatever you want to do. If you're not fully vaccinated, these are the best approaches for you with engaging with your loved ones. Social distancing is the best way to care for your community at this time. So remember, you can stay up to date on your local, state, and national guidelines for testing, quarantine, and general safety, but also on vaccinations. Continue to wash your hands for 20 seconds. Continue to wash your sex toys before and after sex for 20 seconds. And stay home if you're not feeling well. I do want to thank you all again for tuning in. You can follow us at Whitman-Walker on Twitter, Facebook, Instagram. You can also follow us at RealTalkDC_. And you can stay all up to date on everything Whitman-Walker Health. You can also visit our Whitman-Walker website at whitmanwalker.org. And if you need or want to, you can follow me at Sir Dave, Sir_Dave_ on Instagram. I really appreciate your time today, and I hope you enjoyed our COVID-19 update. Have a great week.